In today's video, Zen Health reveals 7 essential vitamins that have been shown to increase muscle strength, maintain bone density, and improve leg mobility, which is especially important for middle-aged and older adults. If you love walking in the park, are passionate about dancing, or simply want to live independently and confidently, this is the video for you. Let's discover how to keep your legs supple, flexible, and strong every day. Before we get started, don't forget to subscribe and turn on notifications so you don't miss out on the latest health tips from Zen Health. And share your thoughts or questions in the comments below. We're always here to help. Vitamin D, the golden key to leg strength in the elderly. As we age, our bodies gradually lose muscle mass, bone density, and mobility, making daily activities more difficult. One of the silent but influential causes is a deficiency in vitamin D, a vitamin that is not only important for bones but also plays an essential role in maintaining muscle strength, especially in the legs. In the elderly, the ability to synthesize vitamin D from sunlight is reduced, while sedentary habits, concerns about skin damage or diseases make them less exposed to the sun. As a result, many people fall into a state of prolonged vitamin D deficiency without knowing it, leading to muscle weakness, reduced balance, easy falls, and difficulty in movements such as climbing stairs or getting up from a chair. Many studies have shown that vitamin D not only helps absorb calcium to prevent osteoporosis, but also supports protein production, improves neuromuscular connections, increases muscle strength, and improves reflexes. In particular, vitamin D helps maintain fast-twitch muscle fibers, the type of muscle responsible for quick reactions and balance. When vitamin D is deficient, these muscle fibers degenerate, causing slow reflexes, cramps, muscle weakness, and leg pain. In addition, vitamin D also has the effect of reducing muscle inflammation, helping to reduce the feeling of pain and muscle tension, a common condition in the elderly. Not only stopping at muscles, vitamin D deficiency is also associated with many other diseases such as osteoporosis, cardiovascular disease, memory loss, weak immune system, and reduced quality of life. The good news is that improving vitamin D levels is not difficult and brings clear results. Older adults should get 10 to 30 minutes of sun exposure each day, early morning or late afternoon, and supplement with vitamin D-rich foods such as salmon, mackerel, sardines, eggs, mushrooms, milk, and fortified cereals. However, food and sunlight are often not enough, so experts recommend that older adults take oral vitamin D supplements at a dose of 800 to 1,000 international units per day. For those with severe deficiency, higher doses may be needed as prescribed by a doctor. Regular blood tests to monitor vitamin D levels are also important to adjust the dose appropriately and prevent risks such as fractures or reduced mobility. Calcium, a strong foundation for strong bones and flexible legs in the elderly. In the elderly, bone regeneration continues, but the rate of bone loss gradually exceeds the rate of regeneration, causing bone density to decrease and bones to become brittle and prone to fracture, especially in the legs and hips. Injuries such as femur fractures, bone fractures, or stress injuries are the leading causes of severe mobility impairment in the elderly. The main cause is often a deficiency of calcium, a mineral necessary to maintain bone strength. However, the role of calcium does not stop at bones. Calcium is also an essential element that helps muscles contract effectively. Movements such as standing up, walking, or climbing stairs require delicate coordination between nerve signals and the movement of calcium ions in the muscles. Without calcium, muscles can be weak, prone to cramps, or not strong enough to maintain balance, making the elderly feel tired, sluggish, and have significantly reduced endurance. To get enough calcium, older adults should prioritize milk and dairy products such as yogurt and cheese, which are rich sources of calcium. In addition, they should supplement with calcium-rich plant-based foods such as kale, bok choy, almonds, tofu, sardines, and calcium-fortified plant milk. Diversifying food sources is an effective way to maintain regular and optimal calcium absorption. However, for people who are on a diet, are intolerant to milk, or have poor absorption, calcium supplementation through food may not be enough. In this case, calcium supplements are a useful solution, especially when combined with vitamin D to increase absorption through the intestines. However, do not abuse them because excess calcium can cause deposits in the arteries, kidney stones, or digestive disorders. The recommended dose for adults is 1,000 to 1,200 milligrams per day from both food and supplements if necessary, under the guidance of a doctor. In addition to diet, physical activity also plays an important role in promoting the effectiveness of calcium. Weight-bearing exercises such as walking, lightweight lifting, yoga, or brisk walking help stimulate bone regeneration and direct calcium to the right location in the skeletal system. If calcium is only supplemented without exercise, the effect will not be optimal. Exercise helps the skeletal and muscular systems to be activated together, creating a solid foundation for flexible mobility and high quality of life in the elderly. Vitamin B12, essential nutrient to protect nerves and increase leg strength in the elderly. When it comes to leg strength and flexibility in the elderly, many people only pay attention to calcium and protein, forgetting that vitamin B12 also plays an extremely important role in maintaining nerve muscle function. B12 helps transmit electrical signals from the spinal cord to the leg muscles accurately, thereby allowing the muscles to function effectively. B12 deficiency causes nerve signals to be disrupted, leading to muscle weakness, reduced motor control, and loss of balance. Common symptoms are fatigue, numbness, tingling in the legs, and reduced mobility. Vitamin B12 deficiency is quite common in the elderly because the absorption of B12 depends on stomach acid and intrinsic factor, factors that often decrease with age. Conditions such as gastritis, reflux, or long-term use of antacids also reduce the ability to absorb B12 from food. In addition, a diet low in meat, fish, or animal products makes the deficiency worse without the patient realizing it. B12 deficiency not only causes weak legs and fatigue, but if prolonged, it can also cause permanent nerve damage, reduced reflexes, poor balance, easy falls, and a feeling of numbness in the legs. Many people mistakenly think this is a normal sign of aging, when in fact it is due to a deficiency of an essential nutrient that can be completely prevented and improved. The good news is that vitamin B12 supplementation can significantly improve strength and mobility if detected early. The main sources of B12 come from animal food such as lean meat, fish, eggs, milk, seafood, especially clams and liver. For vegetarians or those with poor absorption, it is recommended to use plant milk, fortified cereals with B12, or supplement through tablets or even regular B12 injections, which are very safe because the excess will be excreted in the urine. Older people often need higher doses, depending on each person's absorption capacity. Therefore, regular blood tests to check B12 levels are very important, helping to adjust the diet or supplement dose accordingly. Actively monitoring and supplementing vitamin B12 is a simple but highly effective solution to maintain strength, reflexes, balance, and improve quality of life in the elderly. Magnesium, the silent mineral that restores strength and prevents cramps in the elderly. Magnesium is an essential mineral that helps coordinate muscle activity and transmit nerve signals accurately, which is especially important for the elderly. Every movement, such as walking, standing up, or climbing stairs, requires magnesium for smooth muscle contraction, avoiding spasms and reducing fatigue. Magnesium deficiency is a common cause of cramps, leg pain, and restless leg syndrome, especially at night, affecting sleep and overall health. Magnesium also helps calm excessive nerve signals, prevent sudden muscle contractions, and support muscle recovery. In addition, magnesium maintains bone density, supports joints, helps calcium enter bones properly, avoids deposits that cause stiffness and reduced mobility. The elderly are prone to magnesium deficiency due to stress, a diet lacking in green vegetables, seeds, grains, or due to taking diuretics, stomach medications, blood pressure medications. As a result, they get tired quickly, have difficulty walking, and lose strength after simple activities. Adequate magnesium supplementation helps reduce cramps, restore vitality to the legs, improve mobility, sleep better, and increase independence. Magnesium is abundant in spinach, kale, pumpkin seeds, almonds, black beans, whole grains, and avocados. For people with poor diets, magnesium citrate and glycinate are well-absorbed supplements. When provided with enough magnesium, the elderly will feel healthier, move flexibly, have less pain and fatigue, increase reflexes and motor coordination thanks to optimal support of the neuromuscular system. Magnesium deficiency will weaken the entire motor system, making exercise ineffective. Potassium, essential mineral for muscle, bone, and nervous system, health in seniors. Imagine waking up one morning and getting out of bed only to suddenly experience a painful cramp in your calf. This is common in older adults and is one of the classic signs of potassium deficiency, an essential mineral that helps muscles function properly. Potassium plays an important role in regulating the amount of fluid inside and outside muscle cells. When potassium levels in the blood drop too low, muscles contract abnormally, causing cramps, especially in the legs. In older adults, this condition is more common due to poor blood circulation and decreased muscle mass with age. But cramps are just the beginning. Potassium deficiency can also lead to leg tremors, stiffness when walking, or difficulty lifting your leg when walking. This is because potassium plays a role in transmitting signals between the nervous system and muscles, helping to control smooth movement. When potassium is low, the connection between the brain and leg muscles is impaired, increasing the risk of losing balance and falling, which is especially dangerous for the elderly. Not only does potassium stop at muscles, it also surprisingly plays a role in protecting strong bones. Potassium helps neutralize excess acids in the body, substances that can reduce bone density if accumulated over time. Many studies show that a diet rich in potassium helps slow bone loss, reduce the risk of osteoporosis, and contribute to keeping the legs strong in many aspects. So how can we supplement enough potassium every day? Fortunately, nature has provided us with many potassium-rich foods that are easy to eat. Bananas are often mentioned first, but in fact they are only a small part. Sweet potatoes, avocados, spinach, beans, oranges, and baked potatoes with the skin are all excellent sources of potassium, even more than bananas. It is important to incorporate a variety of these foods into your daily diet to maintain stable potassium levels and maximize bone and muscle health. For those who have difficulty absorbing potassium from food or have a restricted diet, supplements may be an option. However, it is important to note that the recommended daily intake of potassium is 2,600 milligrams for women and 3,400 milligrams for men, a level that can be achieved through a balanced diet rich in vegetables, fruits, and legumes. People with underlying conditions such as kidney failure or high blood pressure should be especially careful. monitor their potassium intake, and consult their doctor for appropriate adjustments. Vitamin K, a silent but extremely important coordinator for bone, joint, and muscle health in the elderly. Not only does it help bring calcium to the right address, bones instead of arteries or soft tissue, vitamin K also activates osteocalcin, increasing bone density and strength, reducing the risk of fractures. In addition, vitamin K also helps slow down the process of knee osteoarthritis, improve flexibility, reduce stiffness and pain during movement. In particular, this vitamin also helps increase muscle strength and coordination, a vital factor that helps the elderly maintain balance and avoid falls. You can increase vitamin K1 from green vegetables such as spinach, kale, cabbage, and vitamin K2 from fermented foods, natto, eggs, animal liver. However, for people who have difficulty absorbing or are taking anticoagulants, you should consult your doctor before supplementing. Small but powerful. Vitamin K is an indispensable piece for a healthier and more active old age every day. Vitamin B6, the key to healthy muscles, a stable nervous system, and slowing down aging in the elderly. Not only participating in protein metabolism to maintain muscle mass, vitamin B6 also plays an important role in transmitting nerve signals, producing red blood cells, and reducing muscle inflammation. Essential factors to help the body stay supple, less tired, and move flexibly. B6 deficiency can cause muscle weakness, fatigue when climbing stairs or standing up, accompanied by a feeling of numbness and loss of balance, easily mistaken for signs of normal aging. B6 also helps reduce pain after exercise and improves muscle recovery. In particular, thanks to supporting red blood cell production, B6 helps bring enough oxygen to the muscles, avoiding the feeling of heaviness even when just walking lightly. You can supplement vitamin B6 through familiar foods such as salmon, tuna, chicken, bananas, potatoes, cereals, etc. However, older people with digestive problems or strict diets may need to supplement with pills, but must follow the recommended dose, 1.5 milligrams per day for women, 1.7 milligrams per day for men, to avoid the risk of nerve damage. Nourish your body from the inside. With vitamin B6, flexibility and endurance are no longer too far away in old age. Maintaining health through nutrition, especially 7 vitamins, D, calcium, B12, magnesium, potassium, K, B6, helps increase the strength and stability of the legs. Proactive health care, especially as you age, helps maintain independence, mobility, and quality of life. Nutritional deficiencies can lead to muscle weakness, loss of balance, and risk of falls, but proper supplementation can significantly improve physical and mental health. In today's society, busy lifestyles and unbalanced diets make many people, especially the elderly, susceptible to vitamin deficiencies. To apply, prioritize a varied diet with vitamin-rich foods such as fish, green vegetables, milk, and fruits. Combine gentle exercise such as walking, regular health checkups, and vitamin supplements if needed, according to medical advice. This helps maintain body strength, confidence in daily activities, and live healthier, more independently. If you found this video helpful, please hit the like button to support us in providing more quality content. Share your thoughts for more valuable content. Share your thoughts with us below. Ask us questions or topics you would like us to cover. We would love to hear from you. Hit the subscribe button and turn on notifications so you don't miss out. Check out our latest health tips and knowledge. Stay informed, stay healthy, and we will see you in the next video.